Hey guys, Dr. Jason Tirado, your West New York chiropractor, and today we're talking about sacroiliac pain. And sacroiliac pain actually accounts for more than 70% of the back pain that actually walks inside a chiropractor's office. So a chiropractor's job is actually to differentiate. The first job is to differentiate whether or not a person may have lower back pain coming from the spine or sacroiliac pain, which is usually the most common problem. So what I'm going to do is I'm going to show you two simple exercises that you can do and two strengthening exercises that you can do that can actually help get rid of the sacroiliac pain that you may be suffering. And this video is for Arlene. So the first thing I want to show you is a sacroiliac stretch, and it's done by going down on the floor. So first, if you have bad knees like me, you're going to use a pillow. Right? So you're going to take a pillow, okay, put your knee on it, put your leg up just like that, okay, right? And this is going to open up the sacroiliac joint on the left hand side, all right? And what you're going to do is you're simply going to keep this leg straight at around 90 degrees, put your hands on your hips, and you're going to rock forward just like this. And what's really important here is to go very, very slow, and also to keep your posture and your back very, very straight. So you're going to rock forward, and you're going to stretch out that sacroiliac joint nice and easy. And again, if anything hurts here, then you're going to just stop immediately, okay? But you should be feeling a little bit better as you stretch that sacroiliac joint. And then obviously if you have sacroiliac pain on the right side, you're going to flip over the pillow, put it on the other side, and you're going to do it on the other side. Let me show you that. So you're just going to basically bring the pillow here, bring your knee down, right? And you're going to rock your pelvis, rock your hips forward just like this, stretching out that sacroiliac joint, okay? So the second thing we're going to do is we're going to show you, you pause it. Hey, this is Dr. Tirado, and we are back. And what I'm going to do is I'm going to show you another sacroiliac stretch that you can do while you're laying down on a table. This one's a little bit more complicated. You can do this at your house, either on a couch, you can do this on a bed. So what you're going to do is you're going to lay down on your table. And let's say your left sacroiliac joint is hurting you. You're going to lay down on the table like this, and you're going to let your leg come off the table, right? Just like that. Just let it drop. That's going to open up and stretch out that sacroiliac joint. And then you're going to take your right leg, and you're just going to take it like this, and you're going to hold it up like this, and this is going to let the left leg stretch right down, let gravity take that down, and that's going to gently open up that sacroiliac joint as you pull here, and you're just going to gently just rock back and forth, rock back and forth. And what that's going to do is that's going to open up that entire sacroiliac joint, right? And that's going to take a little pressure off that left-sided sacroiliac joint. And that's going to make it feel a whole lot better. And so now I want to show you two exercises that you can do to actually help strengthen up your sacroiliac joint. One's going to be basic, and the second one is going to be a little bit more advanced. So the first one is going to be just like this. You're going to lay down on the table, just like this, with your hands flat. And what you're going to do, if you can, assuming that you don't have any, this doesn't cause any pain. If it does cause pain, then I want you to stop immediately. What we're going to do is you're going to put your hands down on the table, and you're going to put your legs flat like this at around 90 degrees, and you're going to take your pelvis, lift up your pelvis like this, all the way up as high as you possibly can, and you're going to squeeze your gluteus maximus. That's your butt cheeks, guys. Right here, you're going to squeeze your butt hard as you can. You're going to hold up, and you're going to hold this for 3 seconds, and then you're going to come back down. You're going to rest a second, and then you're going to do it again. You're going to lift up like this, you're going to hold for 3 seconds, and then you're going to come back down. Now, if that is too easy, then what you're going to want to do is you want to do another exercise, which is the advanced sacroiliac strengthener. And what you're going to do is you're going to take your leg, your first leg, you take your left leg, point your toe, bring your leg up about 45 degrees. Keep your right leg bent just like this, and you're going to push up like this, and you're going to hold this position for 2 seconds. You're going to feel that sacroiliac joint, and you're going to come back down. Again, if that's causing too much pain, then you're going to want to stop that immediately. All right? But I'm going to show that to you again. You're going to point your leg straight, push up on the other side, elevate your pelvis so it's off the table about 4 inches, and then you're going to come back down. That's going to strengthen up that sacroiliac joint. You're going to do that about 10 times on one side, and then you're going to do the other side. So let me show you how to do the other side. Again, you're going to make sure that your left leg is nice and stable. You're going to point your toe on your leg like this, and then you're going to lift up just like this, hold for about 2 seconds, and then you're going to come back down. And then you're going to do on that side about 10 seconds. You're going to do about 10 repetitions on that side as well. Now again, if any of these exercises hurt in any way, shape, or form, then you're just not ready to do those exercises. The joints are just too weak and it's too much inflammation and you want to just stop. Just do those passive stretches as I showed you, and once those stretches feel pretty good, then you can move on to some of the strengthening exercises. Folks, it takes a little bit of time to get this and to do it right. And if you do have sacroiliac pain, ice is always going to be your best friend because your sacroiliac joint gets very, very swollen, and the ice will just help soothe the swelling and reduce some of the swelling inside there. And then as soon as but it's always great to start doing some of the stretching as quickly as possible, and then when you feel good with the stretching, you can move right on to the strengthening exercises, and that's those 2 strengthening exercises that I just showed you. Well guys, that's about it. Again, this is Dr. Jason Tirado, your West New York chiropractor, and I'll talk to you soon.